Good morning. This is Lola speaking, the virtual assistant at Riverbend General Hospital. I'd like to speak to Emily. Is that you?
Yes, that's me.
Nice to talk to you, Emily. I'm calling on behalf of your transitional care team. Before I get into the details, I just need to confirm your identity to protect your privacy. Could you please tell me your date of birth?
My date of birth is February 19th, 1949.
Thanks for confirming that. Did Dr. Kendrick tell you that I'd call you?
Yes.
Great. As he told you, I'll call weekly to ask about your symptoms and see how you're getting on, and then pass on the information to your care team.
Okay, that sounds good.
So, first things first, how have you been feeling since you left hospital?
Honestly, I haven't been feeling so good. I feel like I've taken a step back in my recovery. I've been feeling really tired lately.
It sounds like you've had a rough start since getting home. I'll make sure the care team knows. I'd like to know a bit more about how you've been feeling since you got home. Have you had a cough recently?
Yes, I've had this cough that's been bugging me for a few days now. It just won't go away.
Have you been wheezing or had any mucus in your chest?
Yes, a bit of mucus, but not much wheezing.
Understood. And have you felt short of breath as well?
I do feel a little short of breath, but not all the time.
And do you feel out of breath when you're just sat resting? Or is it only when you're moving about and doing things?
It's mostly when I'm moving around, but sometimes I feel it even if I'm just sitting.
Thanks for clarifying that. Now, let's talk about your symptoms at night. Since you were discharged, have you been feeling short of breath at night?
Yes, I have. Sometimes I wake up in the middle of the night because I can't breathe well.
And has this been happening more?
Yes, a bit more than usual this past week.
Right. You should keep an eye on that. Do you find sleeping sitting upright helps with your breathing?
Yes, I've actually been using cushions to sit myself up with. It helps a little.
Right. That's good to know. And do you feel weak during the day?
I wouldn't say so, no.
Got it. And have you had any dizziness or moments of feeling lightheaded since you were discharged?
No, I haven't felt dizzy.
And how about pains in your chest?
No, I haven't felt any chest pains.
That's good to hear. Have you had any heart palpitations?
Not really, but the other day, maybe 3 days ago, I did feel my heart was beating pretty fast when I was out of breath.
Thanks for telling me. It's something your care team should be aware of. Next, I'll need some information about your vital signs. If you have a blood pressure monitor, the cuff that goes around your arm, and you've taken your blood pressure since you were discharged, can you tell me what the reading was?
I don't have a monitor, no.
It's important that you measure it to keep it under control. You can buy a monitor at most pharmacies or drugstores.
Okay, I'll ask my son to buy one for me.
Also, I'll ask you about your weight each week. You can weigh yourself before my call, so you can tell me and we can keep track of it. Do you know how much you weigh today?
164.
I'll make a note of that. Have you noticed any swelling in your feet, legs, or ankles?
No, the medication they put me on has been good, and now they're not swollen at all.
Right. And have you been taking your medication as indicated?
Yes, I always take all my medications in the morning before breakfast like the doctor asked me to.
Great. Have you needed to contact emergency services since you left the hospital?
No, I haven't.
Good to hear. Thank you so much for answering my questions. I'll pass this information on to your care team, and they'll follow up if needed. Before we wrap up, is there anything else you'd like to tell me?
No, I don't think so. I think we've covered everything. Thank you.
Okay, Emily. Now, if you start feeling any worse, don't hesitate to contact emergency services.
Thank you. Okay, I'll keep that in mind.
I'll check in again with you soon. Take care and hope you start to feel better.
Thanks. I appreciate it.